Brooks, and this is Pollyanna, and we're here on behalf of the Department of Physical Therapy at the University of Toronto. We'll be demonstrating a VO2 Max Test, which is the gold standard for measuring oxygen consumption of an individual during exercise. We're using a stationary bike to conduct the VO2 Max Test and make direct measurement of gas exchange. We'll be using a ductless bag, which is a large bag, to capture the test subject's gases. We also need a mouthpiece and a one-way valve to capture the gases from the subject. The other equipment that you need is a heart rate monitor, blood pressure cuff to record blood pressure, a questionnaire to screen individuals prior to exercise, rate of perceived exertion scale, where the patient can rate how hard they're working, stopwatch, a 50 ml syringe to sample exhaled air, and a volume meter to measure the volume of exhaled air. Before we start, we will demonstrate how the Douglas bag works. To do this, we must connect the mouthpiece, valve, and tube to the bag. Then let's have the subject breathe normally into the bag with nose clips on for a few minutes. We will record the time the gas is collected using a stopwatch. The way this works is a set of one-way valves allow ambient air to flow into the mouthpiece as the subject breathes in, and expired air to flow through the tube and into the collecting bag. With this collection of air, we will take a 50 ml sample out with a syringe to be analyzed using percent CO2 and percent O2 analyzers and record the values. After that's done, we will squeeze out all of the expired gas from the bag into the volume meter to measure the volume of expired air in liters. Remember to add the 50 ml withdrawn earlier from the syringe to the collected volume of air. From the Douglas bag, we have measured percent CO2, percent O2, and the volume of expired air. From these, we will calculate VO2, VCO2, and minute ventilation. We will show you these calculations later. Before we begin the test, we must obtain some resting values. Let's start by recording the subject's age, sex, height, and weight. Then, while the patient is seated, let's take some resting measurements of heart rate, blood pressure, rate of perceived exertion, and respiratory rate. Before the test, we've instructed our subject to refrain from a large meal, alcohol, or caffeine consumption. They should also be well rested and well hydrated. Now that we're ready, let's get started. First, we must adjust the bicycle seat so the subject's knee has a slight bend in it when his foot is on the bottom pedal, like so. That looks good. Now we'll equip the subject with a heart rate monitor and put the blood pressure cuff in position so we can take measurements during the test. The subject will start with a 3-minute warm-up of unloaded pedaling. During the test, the subject will pedal continuously at a rate of 60 RPM. The warm-up load is 0 kp. As the test progresses, the load will be increased by 1 kp every 3 minutes until the subject is fatigued and can no longer maintain pedaling rate of 60 RPM or any other warning signs of an abnormal response to exercise. Our responsibility during the test is to continuously record the heart rate, blood pressure, and rate of perceived exertion. It's important that the exhaled air are collected in Douglas bag for at least a full minute at the end of each increment. We're now at the 2-minute mark. We will record the expired gas for the last minute of this increment. We're going to place the mouthpiece in the subject's mouth. Make sure that the nose clip is in place and that the subject has a seal around the mouthpiece. We'll also try and record blood pressure, heart rate, and the rate of perceived exertion during this 1 minute. We will record the time over which the exhaled gases were collected. At the 3-minute mark, we will increase the workload by 1 kp. Like we did earlier, we will take a 50 ml syringe sample and analyze the gas contents, and with the remaining gas, we'll determine the total volume. After all values are collected, we will do the same measurements for the next 3-minute increment. The subject will continue to cycle until he can no longer meet the workload. You may end the test early if you observe any abnormal responses in your subject. If your test lasts 15 minutes or longer, you may end the test. Ideally, the test should be 8 to 12 minutes long. If you observe no abnormal responses, you can assume that the subject can be brought to maximum effort. Encouragement is very important. Push, 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 go, go, push, 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 push. Once the test is complete, the subject should be allowed to cool down by decreasing the resistance on the bike. Record the heart rate and blood pressure during the 1st, 3rd, and 5th minutes of cool down. By now, you should have collected the volume of expired air, the time during which the volume was collected, percent CO2, percent O2, blood pressure, heart rate, and rate of perceived exertion for each increment of the test, as well as doing cool down. We can now plug all these numbers in to obtain a measure of VO2 max.